Hello, students. Hope all is well out there. We are learning about some fun stuff today, y'all. We're going to be learning about bones and joints. And you may recall I sent home with you that cool little glove with the, with the hand thing in there and stuff. So that's going to be used today. All right. So have that ready to go for lab time. Okay. So we've been learning about the human body, reminding me, of course, that you have a human body model pretty soon that you need to come up with. Have you had any ideas on that? So I'll show you a couple of examples at the end here. Okay, but be thinking about that. Let me know. You can email me and ask me, questions about it if you like. Okay, so let's get into our bones. Here we go. Our bones are made up of cells that are surrounded by a hard material. You probably know that bones are hard, right? Yes, they are. And our skeleton is there to give us support. It's like a framework to support our organs on the inside. Okay, we have about 206 bones when you're an adult, but babies have 300. And the reason is, you think, what in the world happened to all those bones? As we grow, some of those fuse together to form one bone. All right, so particularly around, we're going to see some of the skull bones. It's crazy how many bones are in your skull. You'd be surprised by that. But if you look over here on the left, you're going to see our skeleton. If we had been together, I would have had George. George is my little, 2-foot tall skeleton that I pull out of his little coffin and show off to you. And I'd show you all these bones that way. So you may have heard of some of these bones. In fact, I remember one of you asking what the longest bone in the body is, and it's the femur. It's right here, the leg bone, right? The thigh bone right there. I don't know, are you familiar with any other names of any bones? Let me just name a couple and see if you're familiar with it. This one is called the clavicle, right here, also known as your collarbone. So you may have heard of the collarbone. It's called the clavicle. Behind it, in your back, is the scapula right here. That is your shoulder blade on the back right there, the scapula. Those two together are called the shoulder girdle. They help to move the arms around, okay? The breastbone right in the middle is called the sternum. We've heard of ribs. They're just called ribs. The upper bone in your arm is the humerus. The lower bones are the radius and ulna. Okay, so two bones right there. We have our pelvis. We're going to look at our hands more closely here in just a minute. In our legs, we have the femur. We have the kneecap, which is called a patella, tibia and fibula. And then we have our feet, which are similar to the hands. We have tarsals, metatarsals, and phalanges down there. All right, so I don't know if any of you have ever had a broken bone. I never have. I'm pretty old now, and I've never broken a bone. So I think I must have pretty strong bones. We can help our bones be stronger by the things we eat. Calcium helps to make our bones stronger, therefore calcium-rich foods. Yeah, we talked about nutrition, right? And so some of those calcium-rich things, dairy products and things like that. So they come in many shapes and sizes. The typical shape, of course, would be this femur over here on the right. The smallest bones are found in our ears. Did we talk about the ears? I have with so many classes now, I can't remember if it was y'all. But I think I'll show you maybe those pictures of the stapes and the malleus and the incus and the ear right there. Our largest bone right here is the femur. So typically when we draw a bone, it looks like this. So we have the head of the bone, the neck, this is called the neck, and then we have the shaft of the bone and the end. And notice this little plastic covering on the end here? It looks like a white covering there. That is sort of like plastic. It's called cartilage, and cartilage is there to protect the bone from rubbing against other bones. We'll get to that in a minute when we talk about joints, okay? Because our bones are joined to other bones and they can move, fortunately, and they're joined by joints right there. Here's our middle ear bones. The hammer, the anvil, and the stirrup, so the malleus, the incus, and the stapes. Those move, in response to sound waves coming into your ears. This is the eardrum. It makes this move, so the vibrating air hits the eardrum. It starts to vibrate, vibrating the hammer, which vibrates the anvil, which vibrates the stirrup, which then hits the inner ear, which is where hearing takes place in the cochlea. Honestly, I can't remember if we talked about the ear in this class, but you can make a model of the ear if you want to. All right, so here we're gonna kind of key in on the hand bones. This picture right here is actually an X-ray of a hand, okay? And our little activity today is going to be called X-ray vision right there. And these are labeling the bones right there. All right, so if you look at your hand, it moves pretty well, doesn't it? We can have a lot of flexibility with our fingers because there's a lot of bones in there, okay? So move your hands around, move your wrists around, do the hook 'em horn sign. all that, right? That can show you how you can utilize those so intricately. Think about, for instance, if any of you play the piano, you need to have those fingers moving pretty quickly, right? And responding very quickly and being very agile. If you do sewing, like any kind of needlepoint or something like that, that is a very fine movement with your hands. And so all this articulation, meaning joints that are in there, help our fingers and hands to be very useful that way for grasping, for writing. Think about when you're writing with your pen. So let's look at the names of these bones. So look how many are in there. See how those little bones join together? All those are jointed together so that we can have really good wrist movement. Okay, we can almost move it in a full circle, right? It has really good movement there. These are called the carpal bones, the carpal, or sometimes the wrist is just known as the carpus. Notice on the x-ray you can see it joins up to the arm bones right here. That's a joint as well, right there, between the radius and the ulna, right there, joining to the carpals right there. And then above that, in the part of your hand right here that's sort of the back of your hand, that is called the metacarpals, or the region is called the metacarpus. Okay, but these bones are called the metacarpals. And then we get the digits coming off of here, you know, the finger digits, and those are called phalanges. Okay, the phalanges. And you see how we have all that movement in there. In the x-ray, you can actually see there are muscles around here that help to move those. But did you know that we get muscles not just in our hands, but there's muscles in your arms that help move your hands? If you do your fingers like maybe you're drumming your fingers or playing the piano, look at your arm. You can see the muscles in your arm moving as well, because these are called external hand muscles versus the internal hand muscles. That way we can have some strength in our hands without having a lot of bulky muscle in our hand, because the muscles are in our arms. If we develop the muscle in our forearm right here, our radius and ulna area, we can have stronger hands. So think about, we have those fine things like piano playing that we're doing, but think about the strength in our hands. If we want to be able to grip something or work with tools, right, we want to have nice strong hands, and those are going to be muscular movement in there. What are our bones for? They protect our organs, okay? So here they are, like for instance, our skull is protecting our brain. You would be surprised how much of this, you know, when I talked about the babies having more bones, a lot of times it's these, and they fuse together later. There's so many bones in your skull. Maybe I'll show that to you here in just a minute. Our rib cage protects our heart, but it's still movable. Think about it. Our rib cage, we're breathing in and out, right? And our ribs move along with our breathing right there. So they can move because they have joints on them, and they're thin, right? But they still protect our heart and lungs, yet also being lightweight. What if our whole rib cage were just solid bone? You see, that would start to be very heavy on us right there. If our skull were not, it has a lot of empty spaces in it. If those weren't in, I know there's eyeballs right there when we're alive, but there's empty space called sinus cavities, which make our bones nice and strong without being really, really heavy. Then we have our vertebral column. It's like these little bones all put together, beautifully put together, to protect the spinal cord. Spinal cord is very vulnerable, and it needs to be protected. Yeah, this is the part. This is a video. I don't think there's any sound to it, but it shows you all the different bones in the skull. It's crazy. So the colors are showing the different bones. They're not really that color. And then this video is going to actually deconstruct it. It's going to take them apart, and it gets a little creepy here in a minute. All the different colors are different bones, y'all. I bet you didn't know there were that many types of bones, or that many bones in your skull. Here it's going to come apart. Oh, yikes. And look on the inside. Look at those tiny bones on the inside. Each one of those bones has a name, by the way. I don't know them all. Zygomaticus. Look at the teeth. They've come out of the jaws. The upper jaw is called the maxilla. The lower jaw is called the mandible. The back part of your skull is called the occipital bone. Now they're going to come back together. Those teeth are going to go back into those jaws. Isn't that crazy? And then there's joints in there. Those are called suture joints. Here they're all labeled right there. Yeah. So if you're interested in knowing the names of all those, if you go to med school, you'll need to know that. There it is. All right. Here's our rib cage. I mentioned a couple of these bones earlier. There's our clavicle, also known as our collarbone. Does it show the scapula? Remember, it's behind, so it's in the back right there. We have the sternum. Okay. We have the ribs. The ribs right there, joining in there, protecting all that stuff underneath there. Okay. Yeah, it's just showing you the location of the heart and stuff like that. The vertebrae are back behind it right there. Oh yeah, so here are the vertebrae. I would have brought for you today a vertebral bone to look at. I have one. A student brought me one. It was like a cow or something they found out in a field, and I've had it for all these years now, and I like to show it off. So the bones are very specialized shape right here. Here's one bone right here. It goes back here and here and here, all right? And they fit together like a puzzle. And as you go here, you can see the bone, and then there's this little thing of cartilage. It's called a disc. A little disc of cartilage separating the two of them. And you see how I have all those bones. These are the cervical bones, all right? They've taken some of the bones parts away, I guess, so you can see the spinal cord is going through there, right? Then we have our thoracic vertebrae and our lumbar vertebrae, and then the sacrum. That's the tailbone and coccyx right there. So the spinal cord, this is nervous tissue, y'all. This is brain tissue. It comes down from the brain down through the body and then sends out these nerves to tell your body what to do. So it's very important to protect this, but yet we still want to be able to move our back. So this is a beautiful design where you can take and bend over. Think if our backbone were a solid rod holding the cord inside of it. We couldn't bend over. That would be very inconvenient. You couldn't tie your shoes very easily, could you? Yeah. And so this gives you that flexibility, but yet still protecting that spinal cord right there, because it's important our spinal cord not get severed or damaged, right? Because that can cut off the brain's talking to the rest of the body and result in people having paralysis or being paralyzed, that kind of thing. Also, I'll just happen to mention this cartilage between here. Most joints have cartilage between them to help cushion it, to keep it from being rubbing against other bone, because that would cause pain. There's a lot of nerve endings in our bones. If you've ever broken a bone, you know that. It hurts. But these keep them from rubbing against each other. And if everything's healthy and we have everything working right, then these little discs will be right where they need to be, sandwiched in between. There is a thing called a prolapse disc, or a disc problem, where this can be squeezed out and the bone can touch on bone. It causes a lot of pain. And then, of course, we worry a little bit about our spinal cord, too, about causing any damage with our spinal cord right there. Okay, so that's called a bulging disc or something like that, disc trouble. The bone tissue is living tissue. They're actually growing, reshaping all the time. In fact, it's in the bone where our blood is made. Okay, so we're looking at a long bone here. This is probably the femur. It's just the easiest one to see everything on. And in the very middle, it's hollow. And there is stuff inside there. It's called marrow, or bone marrow. If you've ever cooked with bones or got bones in your food or whatever, you may have noticed the middle part of it might be gone if your food's already cooked. If it's not cooked, you might see there's this goopy stuff. I would have brought bones for you to look at today. I have a long bone, a sagittal cut of a long bone. That means it looks kind of like this, but it's only this part of it right here. Yeah, but I would bring that to you. Plus, I bring bones that look kind of like soup bones. If you go to the grocery store, you can find soup bones. Guess what people make with it? Soup. Yeah. So that's marrow in there. Marrow, the bones, one of the main jobs of the bone is to store things, to store minerals that you might need later, and to store fat. And that marrow is exactly what that is. It's fat. And when we cook soup, that's why we add it to it, because fat makes things taste better. Fat is good for us, right? If you give a bone to a dog, what's he do? He chews and chews to get to the middle of it, because what's in the middle? The yummy fat. And that's what he's chewing for right there. So that is, if I need fat, I can get it out of the marrow right there. If I need it, if I don't have enough or whatever, then it's stored there for me. Also, the bone stores minerals in the hard parts of it, okay? So notice we have this part of the bone right here is called compact bone, all right? And that means it's very, very compact. It's very squished together. Meanwhile, this bone right here is called cancellous bone, also known as spongy bone. But I need you to understand it's not called spongy because it's soft like a sponge. It's called spongy because it has holes in it like a sponge. It's not soft, it's hard, but it's got all these little holes in it. And it has holes in there for a reason, all right? This has a type of marrow in it as well, and the marrow there is called red marrow. The marrow here is called yellow marrow, fat. The marrow here is called red marrow. And the reason it's called red marrow is because that's where all of your blood is made. One of the other functions of your bone is to make blood cells. Crazy. It's called hemopoiesis. Hemopoiesis is the process of making blood cells. Red blood cells, white blood cells, platelets are all made in your bones. All of them. Okay. The compact bone, of course, is to give you strength. So you stand up straight. It is storing things like calcium and other minerals that are being stored in there. Notice here, my blue part right here is that cartilage. Remember, that's because it's going to touch another bone right there. All right? There's no cartilage here because it doesn't touch a bone there. It touches a bone on this side, and the cartilage is going to keep it from rubbing against the bone. It's going to be like a hard plastic covering over the top of it. So the names of these are called the diaphysis, is this long part right here. The epiphysis are on the ends right here, okay? The epiphyseal plate right here, this is where growth happens. So y'all are still growing tall. I'm not growing tall anymore. I'm just growing wide now, right? So the epiphyseal plate is where the growth happens. So the growth actually starts here and pushes this way. So really, and this is just very simplified, the oldest part of your bone is right down here. The truth be told, though, the bone is always remaking itself, okay? Sort of like it's reforming the cells. It's always making them stronger and things like this. Here we're looking at it a little more closely. All right, so here is our compact bone right in here. Notice our marrow. It's yellow marrow right there. Compact bone surrounding it. Notice the blood vessel. What's the blood coming there for? Coming to collect the blood cells that have just been made in this part, which is our spongy bone, all right? Also known as cancellous. Look at those blood vessels coming in there, coming to collect those cells that have just been made. Furthermore, the blood is feeding the compact bone right here. There's a lot of blood supply to your bone. Hopefully you haven't had a broken bone. It's very painful. Sometimes you can get a very, I hate to say it's a minor break. No breaks are good, but a minor break would be called a green stick, where you just break it, but it doesn't come apart. But if the bone comes apart, that is called a compound fracture, and it actually can poke through the skin at that point. Yikes. And then you have to be really careful because we have all that blood in there, and you don't want the blood to be exposed to any kind of bacteria, right, that could cause an infection. All right. Here's what the cells look like in there. So this is our compact bone, all right? In the middle would be the blood vessel coming up. And then these are different cells. And then these little black things right here are the way the cells communicate with each other. But notice they're compacted into these circles right there. They get them nice and strong right there. I think this must be our, let me see. Yeah, that must be our cancellous bone. See the holes in it right there with little communication cells right here communicating with each other. So the rest of the bone knows what it's like. So this cancellous has holes in it for the blood supply to make it has the red marrow that makes the blood. Here we are, talked about storage earlier. It's storing fat here. It's storing minerals here. Notice all the blood supply coming there. Okay, is that all I want to talk about bones? Maybe so. Yeah, so storing fat, storing minerals. Calcium being the main one right there. Okay, moving to joints. Joints, bones are joined together by joints. We have over 200 of them, and there are different types. Some of them are immovable, like the ones in the skull. Those are called suture joints. They don't move anymore, but they did once when you were a baby. Think about a baby when they're born, how they have that, what we call the soft spot in their head. Do you know what I'm talking about? It's called the open fontanelle is what it's called. That's because the joints haven't grown all the way together. The bones haven't grown all the way together. And why is that? Why do babies' skull joints why are they not together? Well, it's because they have to be born through the birth canal, and guess what? Their head actually their bones, their skull will actually move a little bit. So if you've ever seen a picture, for instance, of a brand newborn baby, he kind of has a misshapen head, kind of like a little cone head going on there. That was God's plan, to let that head fit through the birth canal. And then it turns round after that, right? And then those joints close over, and after a while, maybe a year or so, that little open spot, that soft spot on the top of the head is all closed up. Most joints, though, are for movement. Okay, we call those synovial joints. Synovial is the type of fluid that's in there that keeps them nice and lubricated. Okay, so we have the cartilage that's keeping them from rubbing, and then we have this kind of oil, if you want to call it, like oil, like a lubricant. It's sort of the same consistency as the white of an egg, a raw egg. You know how that white's kind of real slippery? It's kind of like that, called synovial fluid. One type is called the ball and socket. It's right here in our hips and in our shoulders. They have the most range of motion. They can move the most. So think about your shoulder. It can go all the way around if you're pitching a baseball and this kind of thing. But then contrast that against the hinge, like the elbow joint right here. The elbows and the knee is the same thing as a hinge. Think about if you outstretch your arm and you hinge your elbow right there, try to bend it backwards. Well, it won't go backwards, right? Because it only goes the one way. So it has less range of motion, not as much range as the shoulder has, but it's very strong. Okay, so our knees and our elbows are very strong. Those joints are good. And then the pivot joint is like in your neck. If you shake your head back and forth, no, there's a pivot joint right there. Okay, you can also shake your head, yes. That's up and down. That's called the ellipsoid joint. So there are about 6 different types of joints, of synovial joints, actually. And so we don't have to learn all of those here. But let's take a look at the knee. It's one of the most fascinating ones right here. So we have our bone coming down. So this would be our femur meeting up against our tibia, against our tibia. Okay, I almost called it the fibula. All right, so notice how they're joined together. We have a articular, it's called articular cartilage. Articular meaning we're going to have movement right there. Also, we have a cavity right here called the synovial cavity. That's where that synovial fluid is, okay? And that's the stuff that's kind of like the egg white. And then we have another kind of a balloon sort of thing around it right here called the bursa sac. The bursa sac, okay? And a joint capsule right here. And that bursa sac is almost like all the way around like this. If you've ever known anybody who had something known as bursitis, it was the inflammation of the bursa sac, which is the inflammation of the tissue in the bursa, which causes pain. Inflammation usually does. All right, right here we can see the muscle coming down and then connecting from the top here down into the bone beneath it, okay? That's how muscles get leverage on our bones. They're, one of the job for bones is movement, and they move because muscles are pulling on them. All right, and we have ligaments will hold the bone together right here. So from it's right here entered into the bone, it actually becomes bone tissue. It comes out and connects down here to the bottom right here. Okay, there's also all sorts of ligaments on the inside right here. Let me see if I have a picture of that. Yes, I do. Excellent. So ligaments connect bone to bone. I like this. Look, here we have something known as the ACL, the anterior cruciate ligament. Okay, we also have the posterior cruciate ligament right here, but the ACL is the one that many athletes have a problem with, especially soccer players, people who do a lot of running for their sport, whatever that happens to be, and they can blow out their ACL. What they do is eventually they just stretch it beyond its. Think of them like a really, really strong rubber band, and it will get stretched out. Okay. So if that happens and they blow out their ACL, then that actually has to be replaced. They go get a ligament from another part of the body and they implant it right in there, and good as new, pretty much. They do a pretty good job. This is called the lateral cruciate ligament and the medial cruciate ligament. Okay, so those are all keeping your knee. Remember I told you the knee joint's very strong. Those ligaments are holding those bones together very strongly. And keeping it together. And furthermore, we have all this strength in the hinge, the fact that it won't go the other way. Okay, so ligaments connect bone to bone. You can see that cartilage real nicely right here. Remember, this area would be filled with synovial fluid, keeping that nice and slick inside there. There's our cartilage. This is once again the knee. Notice, I think in this picture, the kneecap, the patella would have been right here. It's been taken away, so we can see better. All right, you can see the kneecap right there. All right, and look at the cartilage between. That's the blue stuff right there, and the cartilage right here. Remember, this bursa area would be filled with synovial fluid. So cartilage is strong. It's pretty flexible, although the one that's between our bones is the hardest type of cartilage, and it's acting like a cushion. We can also find softer cartilage in our ears and our nose. So if you bend your ears, that's called elastic cartilage. So it's also cartilage, but I need you to understand the cartilage in your joints is much harder than this, okay? If you feel your nose, the very tip of your nose is bendy, but feel the very top of your nose, you know, where it's really hard right there, that's harder cartilage right there. There's different types of cartilage, and the hardest type is found in our joints right there, in the bone joints. They help, the one in our ear helps give shape to our ear. Okay, now it's time here to get to our lab right here. We would have been looking at bones, so that would have taken some time to take. I would have given you some gloves to touch the bones, and they're preserved. You can get some bones from like the grocery store. Okay, now they will be fresh bones, like for soup bones or something like that, and take a look at them. So if you do touch them, you need to be sure to wash up afterwards. And maybe if your mom is cooking some soup or something, you can ask her to pick up some bones, and you can see them that way. We would have been looking at George, his different bones, and then the joints on there. But then we have our little x-ray vision activity. I would have also brought you x-rays to look at, x-rays of bones, because they're pretty cool to look at. So here it is. It looks like this, right? It's that little glove thing. And here's a video of me telling you how to do that. Hey, everybody. Hi. Remember, this is our activity for this week. I sent this to you, right? So we have our bones. And what you're going to do, and I actually outlined them already, but you're going to take it, put it. I think it's easier if you put it on your hand. You're just going to outline with a Sharpie marker the bones like that. Okay? Yeah. And so then once you do all that, then you can take out the. Sorry, my hand's a little wet, I guess. Take out this part, then just put your hand in. And then, looky there. You can see all their actual bones. So you can so here's our carpals and our metacarpals and our phalanges right there. It looks like the black was better than the purple I used earlier. Okay, so y'all do that. Have fun with it. Okay, and those gloves are probably kind of large for you. So you may want to outline that. You don't have to have it on your hand to outline it. It just seemed to me maybe easier to do it that way. You can lay it flat on the table and then outline it with your Sharpie marker. And then maybe give it to one of your parents or older sibling or something to put on and see if you can see their bones. And you can show off and tell them you know the names of those bones, right? The carpals, the metacarpals, and the phalanges. Very cool. My students tend to really have a lot of fun with this activity. I know it's simple and small, but I really wanted to send it to you so you'd be able to have that little bit of fun with it. I wish we were together and you could actually see the bones I had and stuff like that. So I put in a couple of how to make a bone model. So if you were thinking maybe a bone model might be something you want to make, here's somebody's really fancy version made of clay, I guess, right? And it shows the cartilage and the compact bone here, and then the inner part, and then we see the marrow and blood supply. And then look how they painted the red on here for the red bone marrow, right? That's where the blood's made. And then right here you can see the epiphyseal plate even. So that's a really nice model right there. It's pretty fancy. I don't expect y'all to necessarily do something that fancy, but here's one that's made with Legos. Look at that. That might even be Duplos, right? Yeah, and so you have your, they just wrapped it with some tape right here, and then this is our compact bone. They used a little tube right here for the spongy bone. And then some blood vessels. Those are just little, you can use yarn or something as blood vessels, something like that. I love the way that this one has been labeled. That's very nice. Here's somebody's, I kind of think these are made out of Rice Krispie treats. Do you think? Am I right? And I love the way they have their little key down here, right, telling what everything is. So our spongy bone, our compact bone, our blood supply, and then this green stuff is a periosteum. That's just going to be covering the bone. Look, it looks like a group worked on it, And so if you didn't, maybe didn't touch it too much, we could eat it afterwards. Something like that. This is going, bigger. So we're looking at the two bones. So we have our humerus and our radius ulna. I don't know what that says right there. And then they've used balloons to show the muscles, and then they have a hand over there to show where the hand was. So that's kind of a nice little model right there. It's somehow connected. These might be rolls of paper. I've done that with my students before, where I roll up paper and I connect them with like a brad, those paper fastener type of things. Yeah. And then here somebody did, that's kind of fun, using straws and the string, and it makes the actual hand move. The paper needs to be pretty flexible, like some construction paper or something like that. So this might be a good idea if you want to do bones as your model. But remember, you can do any thing in the human body, even if we didn't study it per se. So you can do a model of muscles. You can do a model of the heart, the lungs, the brain, the kidneys, eyeball, anything you can think of. Okay, and I told you it is okay to use a kit. So if you went to Hobby Lobby, which I think, hallelujah, that they're open again, you can maybe go in and get a human body model kit, or you can get some of that cool clay and make something out of clay. All right, and so remember, I'm going to try to get us together on that last day of classes, which will be 2 weeks from today, right? Next week, what are we doing next week? We have something going on next week, another class, I guess, and then the next week we do our models. Is that right? I'll have to look that up. All right, I'll be sending this to you shortly, gang. Hope to see you real soon.